Thank you, Anna. As previously outlined, the provision of high-quality care in laryngectomy patients will directly impact their quality of life and their recovery processes in the short term and in the long term. We aim to find a clinical practice guideline that was specific to speech pathology and provided information and recommendations across all related areas including swallowing, speech, and voice, to name a few. We started by developing a search question to assist us with our clinical practice guidelines search. We chose a more general question for our initial search to ensure that our results were all-inclusive. Therefore, we aim to find a laryngectomy-specific clinical practice guideline from the question, what are the current laryngectomy-specific guidelines available? From this search, we were hoping to find recent clinical guidelines related to the specific population of laryngectomy. However, these guidelines were not specific to particular health professions. If the search was refined to be discipline-specific, for example, speech pathology related, it did not yield the adequate number of results. From this initial search, we then sorted our CPGs to find one that would establish and encourage high-standard laryngectomy management in speech pathologists working with laryngectomy patients. Our concept map outlined in this slide was used to construct the initial search. We made use of truncation, Boolean operators, and quotation marks to ensure our search was all-inclusive. We used 3 different search methods, the first of which was a search of the library databases. We used Medline, CINAHL, PsycInfo, and Embase. Medline was used as it is widely recognized as the premier source for biomedical literature. The search initially yielded 27 results. Of this number, 2 were deemed most relevant to our CPG search. CINAHL was used due to the diverse range of resources available and its ability to yield results specific to allied health professions. This search yielded 9 results, 3 of which were deemed relevant to our search. PsycInfo was chosen as its focus is on psychology and the related disciplines, as opposed to the other 3 databases whose focus lie in medicine. This search yielded no results. Our final search was of Embase, chosen due to its current and relevant nature. This search yielded 32 results. Of this number, 4 were deemed most relevant, and 1 of those had been found previously in the Medline search. This slide shows the total yield of 8 from the search of library databases. We then performed a search of the clinician guidelines websites. This search was speech pathology specific, as we chose 2 websites directly related to the field of speech pathology, Speech Pathology Australia and the American Speech Language Hearing Association. We also chose the National Health and Medical Research Council to again ensure our search was all-inclusive. We searched these databases by accessing the guidelines section on the company website and searching for laryngectomy-specific guidelines. Both Speech Pathology Australia and the National Health and Medical Research Council yielded 1 result each. Speech Pathology Australia's result was deemed highly relevant. However, the National Health and Medical Research Council's result was not. American Speech Language Hearing Association website did not yield any results. This slide shows the total yield of 1 result from the search of clinician guidelines websites. Our final search was a smart Google search. Parentheses, quotation marks around the phrases, and the Boolean term "or" were used to search laryngectomy clinical practice guidelines. This search yielded 3 relevant results. They are presented on this slide. Our total yield was 12 CPGs that we deemed most relevant to our search question. After a comparison of these 12 results, we found that 1 of the results that best answered our inquiry question and by providing speech pathology specific guidelines and recommendations relevant across multiple areas of practice. Our nominated clinical practice guideline was found on the Speech Pathology Australia website and is entitled Laryngectomy. I would now like to present Jos to demonstrate a detailed summary of our critique of this clinical practice guideline using the Agree To tool.